Good evening, ladies and gentlemen, and thank you once again for joining us for yet another COVID-19 press briefing when we bring you an update on Dominica's situation as it relates to this pandemic. We welcome this evening among us the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, Kent Edwards, Health Liaison Officer, Dr. Martin Christmas, the National Epidemiologist, Dr. Shaludin Ahmed, Clinical Psychologist at the Dominica China Friendship Hospital, Lesley-Ann Waldron-Martin, and the Head of the Criminal Investigation Department, Superintendent Davidson, Valerie. Let's get things rolling this evening right away with an update as far as surveillance and statistics are concerned with Dr. Ahmed.
Thank you, Ms. Harry. Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Parliamentary Secretary in the Minister of Health, Wellness and New Health Investment, Kent Edwards, Health Liaison Officer, Dr. Martin Christmas, Clinical Psychologist at Dominica China Friendship Hospital, Ms. Lesley-Ann Waldron-Martin, Head of Criminal Investigation Department, Superintendent Davidson, Valerie. Pleasant evening to everyone. The total confirmed cases of COVID-19 remain at 16. 15 have recovered. 1 is to be re-evaluated over the weekend. As of today, a total of 430 individuals have been tested for COVID-19 using PCR method. Of these, 414 are negative, with a positivity rate of 3.5%. At this stage, among the OECS countries, only St. Lucia is ahead in terms of decreased positivity rate, that is 2.5%, using the same PCR method of testing. With regards to the community-based screening, the process has been commenced. The objective is to conduct active surveillance at the community level. This method includes investigation of any clinical symptoms within the past 14 days and conducting testing using rapid test kits. Anyone suspected of having COVID-like symptoms and/or is reactive to the test kits will then have a confirmatory test conducted using the PCR method. This surveillance activity will help to detect an active case in the community, isolate the case, if any, and conduct contact tracing as necessary. This measure will enable us to set up a structure for screening methods at the community level prior to opening up of the country. In Dominica, it is evident that our continued practices of social distancing, good hand hygiene, and proper respiratory etiquette has successfully curbed the impact of COVID-19 pandemic. But here at the Ministry of Health, we will continue to remind people and stress the importance of these practices due to the overwhelming evidence we have in favor of them. For example, studies published in the Lancet have shown, based on mathematical transmission models, that physical distancing interventions comprising of school closures and workplace distancing can reduce the number of COVID cases by 78 to 99%, no matter how high or low infectivity rate of this virus is. Also, general mask wearing, whether it be a homemade cloth mask or professionally made respirators, has been shown to decrease viral exposure and increase risk on population level, which also keeps the infection incidence rate at bay. Although we are going back to basics with hand hygiene, it is important to note that using proper hand washing practices will remain crucial in reducing the virus transmission. Lastly, droplets from coughing and sneezing can travel at most up to 200 miles per hour Thousands of those drops travel invisibly up to distances of 45 meters. This is why we must always cough and sneeze into a tissue, and if tissue not available, into your elbow. So we need to play it safe and play it smart. Therefore, continuing to wear masks when out and practicing good hygiene is essential in order for us to move past this lockdown situation. And I thank you.
And our thanks to Dr. Ahmed. And like he mentioned, here in Dominica, our confirmed cases remain at 16. 15 of them have recovered fully, and 1 remains in isolation and will be reevaluated. Again, we cannot emphasize enough the importance of continuing to practice all the protocols and all the safety measures that we've been doing so far. Obviously, that has been working in our favor. For those of you who still don't see the importance of this, we urge you, for the protection of yourself and others, to adhere to all of those protocols. Our next presenter this evening works very closely with the Acting Chief Medical Officer, Dr. Kevin Ferrara, and that's the Health Liaison Officer, Dr. Martin Christmas.
The Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, the Honorable Kent Edwards, National Epidemiologist, Dr. Shalodin Ahmed, Clinical Psychologist at the Dominica China Friendship Hospital, Mrs. Lesley-Ann Waldron-Martin, Head of the Criminal Investigation Department, Superintendent Davidson Valerie, Health Communications Officer, media personnel, and of course the listeners and viewers at home. A very pleasant good evening to you all. On the behalf of the Ministry of Health, Wellness and New Health Investment, I would firstly like to communicate our sincere thanks and appreciation, congratulations to you, the Dominican public, for your support and cooperation thus far. It has indeed been a phenomenal challenge for us dealing with this COVID-19 virus. And we would like to indicate to you that, yes, we are very pleased that you have cooperated with all of the measures that we have requested of you thus far. And this is the reason why we are able to boast of the statistics that we have now. However, the problem has not been solved. We urge you to keep up the good work in areas such as the wearing of facial mask or face covering, social distancing, cooperation with quarantine, and the like. We continue to encourage you, the Dominican public, to be your brother's keeper and look out for illegal practices such as the use of the commonly called backdoor entrance to the country, because of course the closure of our borders is something that is very necessary, and we continue to urge you to cooperate with us on that. In addition to that, from a health perspective, we are also wishing to congratulate you for cooperating with the social distancing at the hospital in terms of visitors and the movement of persons within that facility. There is no wish from the Ministry of Health to make this harder for you than it already is. There is no interest in having arrests of persons, etc., but COVID-19 is still a very real threat. We all want to return to normalcy and we require economic revival. But how far we can go with this depends largely on you and the cooperation from you. We are proud to announce to you that we only have 1 active case in isolation on island. However, we also wish to remind you that from 1 active case, we arrived at the very serious threat that we have been facing these past months. At this point, we continue to urge you to cooperate with all of the recommendations coming out of the Ministry of Health and other authorities. We look forward to your continued cooperation, and of course, we expect that we will be able to face this challenge and rise from it. Gradually, We are prepared to begin the return to normalcy. And as I mentioned earlier, how far the ministry is able to go with that kind of leeway depends on how well you cooperate. If there is a breakdown in cooperation, then we are going to see a rise again in cases, as you have noticed internationally. And this is not what we desire for Dominica. We urge you to cooperate with us in our attempt to be one of the countries that is able to return to normalcy, have persons return to their economic activities, yet not experiencing an increase in cases of COVID-19. In closing, again, I will remind you that each territory in the region has a different approach to this. The situation is different, and we as Dominicans are all in this together. So whatever is requested of you is not intended to make your life more difficult, but simply to protect you and have us survive this as best we can. I thank you.
Thank you to Dr. Martin Christmas, the Health Liaison Officer. And like he said, the sooner we all comply, the sooner we'll get just a little bit more leniency when it comes to these restrictions. And as we continue to grapple with the pandemic and grapple with the new normal, coping mechanisms are always key to our survival. So many people find it hard right now to deal with things like their finances, to deal with things like being home all the time, to deal with having their children home all the time. And that's why we always like having with us the clinical psychologist, Mrs. Lesley-Ann Waldron-Martin, who is our next presenter.
Thank you, Ms. Harry. Minister of Health, Wellness and New Investment, Honorable Dr. Irvin McIntyre, Parliamentary Secretary in the Ministry of Health, Wellness and New Investment, Honorable Kent Edwards, Health Liaison Officer, Dr. Martin Christmas, National Epidemiologist, Dr. Shalauddin Ahmed, Head of the Criminal Investigation Department, Superintendent Davidson Valerie, listeners, viewers, fellow Dominicans, good evening. Many of us are going through a period of grief right now. Grief is a normal psychological response to loss. Regularly, we relate to grief or refer to grief based on death, but grief is a response to loss of any kind. Loss of livelihoods, loss of relationships, and in this situation, loss of our normal way of life. At one end, we feel that it is temporary, but we also realize our world has changed. We are grieving collectively, something we may not have done on such a large scale before. While some are grieving, many of us are additionally in a state of what is dubbed as quarantine fatigue. According to psychologist Dr. Harstein, quarantine fatigue is how we are currently feeling in regards to quarantine, isolation, physical distancing, and other stipulated practices like wearing of masks and gloves. As social beings, our present inability to be fully social may cause us to experience negative feelings such as anxiety, stress, and even the extreme form of anger. These negative feelings may be the cause of the recent lapse and defying of the boundaries related to curfew and wearing of masks. Many echo the strain that right now it is simply becoming too much to bear. Although the frustrations and overwhelming feelings are normal, we need to remember this pandemic is not yet behind us. It might also seem understandable that people are adapting measures to suit their personal lives. But we should not be selfish, nor should we act as hopeless bystanders while others fight against COVID-19. Let's not think of this as a period where we are being punished or that our rights are being taken away from us. But let's look at it as we could work towards making a few sacrifices on the individual level, which will benefit our entire society. Those of us who know better need to demonstrate adherence to the guidelines of the authorities. Social norms play a major role in shaping behavior, and a collective effort to uphold safety measures will make these practices more socially acceptable. Towards this effort, family members, work colleagues, community and church leaders should have discussions in an appropriate setting with the objective of getting everyone to regain the incentive of following rules as diligently once more. But how do we continue to cope and comply when time makes it feel more difficult to stay inside, to wear masks, to wear gloves, and to physically distance? Let's work towards practicing good self-care habits, including healthy sleeping patterns, disconnecting from unreliable news sources, and taking social media breaks. Try to allow time for physical exercise and maintaining your diet while staying away from less healthy vices. Routines and schedules are very helpful in our lives. So if your previous routine was disrupted, try to find a new one and stick to it. Make personal time for yourself while also connecting with family and friends. Remember, we may be physically distant, but socially connected. So let's connect to play games, to talk online, to practice any other positive coping mechanisms to get us safely through this time. We should also pay attention to the negative coping mechanisms like drug and alcohol misuse and abuse. It is important to note that people are resilient. We as Dominicans are resilient, and we have the ability to get through hard times. We have gone through hard times before. Even through this resilience and through these hard times that we face, maybe we may have the possibility of even demonstrating growth after this traumatic experience. We can't predict precisely what's next, but we can work both individually and collectively towards strengthening our mental resilience. Thank you.
Again, our thanks to the clinical psychologist at the Dominica China Friendship Hospital, Lesley-Ann Waldron-Martin. As she said, coping mechanisms, both negative and positive, have to be paid. We have to pay attention to those. We have to pay attention to what is getting our attention. Are we coping more negatively? Are we drinking more? Are we spending more time on following social media trends that perhaps aren't the best choices? How are you choosing to cope? No matter what she says, the choice remains yours. So we urge you to please use the positive coping mechanisms. There are always resources available to you. There are always people you can talk to if you need to. Next this evening, our presenter is the head of the Criminal Investigation Department, Superintendent Davidson Valerie. Of course, we've been keeping the police very busy. And with the weekend coming, the superintendent will highlight what the curfew order is for the weekend.
Minister of Health, Wellness, New Health Investment, Honorable Dr. Irvin McIntyre, Parliamentary Secretary in the Ministry of Health, Wellness, and New Health Investment, Kent Edwards, Health Liaison Officer, Dr. Martin Christmas, National Epidemiologist, Dr. Sheldon Amid, Clinical Psychologist at the Dominica China Friendship Hospital, Miss Lesley-Ann Waldron-Martin. Listeners, in Radio Land and via the media, good evening. The Honorable Minister of Health, Wellness and New Health Investment, via media briefing on Saturday, May 9th, 2020, advised on the easing of certain restrictions introduced to prevent the spread of COVID-19. I will today speak on 3 of these conditions. That is, the adjustment of the curfew hours, the use of the beaches and rivers, and the opening of additional businesses. The Commonwealth of Dominica Police Force is mandated to ensure that the conditions stipulated in the Emergency Powers Curfew Order 2020, SRNO number 20 of 2020, are strictly enforced. As a result of these new measures, our vehicular checkpoints, patrols on land and on sea will continue. A great number of our populace have continued to adhere to the conditions stipulated in the curfew order. However, there are a few people who believe that they can challenge the authority of the police. I want to report that over the May Day weekend, May 2nd to May 4th, 2020, 28 people were arrested for violation of the curfew order. I will now speak on the new measures articulated by the Honorable Minister for Health in his media brief on May 9, 2020. That is the adjustment of the curfew hours. The curfew will now be from 7 p.m. to 5 a.m. Monday to Saturday. On Sundays, there will be a total lockdown. The lockdown will commence from 7 p.m. on Saturday to 5 a.m. on Monday. What that means is that from 7 p.m. to 5 a.m. Monday to Saturday, and from 6 p.m. on Saturdays to 5 a.m. on Mondays, only essential service providers or individuals granted permission by the Commissioner of Police will be allowed access. I want to reiterate that access will only be granted to essential service providers or individuals who have permission from the Commissioner of Police. The use of the beaches and rivers. Effective Thursday, May 7, 2020, individuals were permitted access to the beaches and rivers from 8 a.m. to 5 p.m. Monday to Saturday. Groups of 10 persons or less will be permitted to access the beaches or rivers. There shall be no parties, barbecues, or consumption of alcohol on the beaches or at the rivers. That simply means that individuals will only be permitted to swim or bathe on the beaches and at the rivers. However, physical distancing must be maintained, and any officer of the Commonwealth of Dominica Police Force reserves the right to deny access to the beach to prevent any overcrowding. Anyone found in violation of the conditions for utilizing the beaches will be prosecuted. The opening of businesses. A number of other businesses were permitted to be open effective May 7, 2020. These businesses will operate between the hours of 8 a.m. and 4 p.m. Monday to Friday, and 8 a.m. to 1 p.m. on Saturday. Business owners are reminded to strictly comply with the conditions stipulated for reopening. Failure to do so will result in temporary closure of your business. I would like to remind the owners of bars, nightclubs, game shops, manicure and pedicure shops, spas, salons, and barber shops that they are to remain closed. Citizens and residents will be allowed to procure alcoholic beverages, but the consumption of alcohol in a public place is still prohibited. Failure to comply with any of these provisions may result in an arrest. The penalty for any offense under the Emergency Powers Statutory Order is EC $500 or to imprisonment for 12 months. Any goods or monies associated with the offense may be confiscated. Ladies and gentlemen, I want to continue to implore you to follow all the protocols issued by the Ministry of Health. I want also to inform you that the police officer is now home, having been cleared of COVID-19 virus. He is in good health and will remain home until cleared to return to work. In closing, I want to thank all our frontline workers, particularly the police officers who go beyond the call of duty to ensure that their functions are carried out effectively. Let us all work together to ensure that we win the war over COVID-19. I thank you.
Our thanks to Superintendent Davidson Valerie and to the entire Dominica Police Force for their diligence so far as we continue to battle this pandemic. For those of you who still remain uncertain, the curfew hours are as follows: 7 p.m. to 5 a.m., Monday, Tuesday, Wednesday, Thursday, Friday, up until 5 a.m. Saturday. Then you are allowed to go out from 6 p.m. Saturday until 5 a.m. Monday, complete lockdown. You are allowed to access the beaches, but again, you can do that daily from 8 to 5, but from Saturday through Monday, you cannot access the beaches. Again, we will be on complete lockdown. Small groups allowed at the beaches. Physical distancing stressed, and also no picnics on the beaches. Opening hours for businesses, 8 to 4, Monday through Friday, and 8 to 1 on Saturday. Businesses, again, we're urging you. We've noticed that people are less compliant now at the businesses. We are urging you to ensure that both your patrons and your staff adhere to the protocols, wearing of masks, sanitization and disinfection, and the physical distancing that we encourage. Our final presenter this evening is the Honorable Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre.
Before I begin, let me recognize the Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, Honorable Kent Edwards, our Health Liaison Officer, Dr. Martin Christmas, National Epidemiologist, Dr. Shalauddin Ahmed, Clinical Psychologist at the Dominica China Friendship Hospital, Lesley-Ann Waldron-Martin, and Head of the Criminal Investigation Department, Superintendent Davidson Valerie. A pleasant good evening to everyone listening at home and abroad. It's always a pleasure besides being my duty, to be part of our press briefing. I must say we've had some very informative presentations this evening, and this is all part of our plan in keeping the public well informed and familiar with what's going on regarding COVID-19. Our status keeps improving, and at present we have only one active case. We all hope this will be zero over this weekend. Our quarantine numbers have increased to 31, and this is as a result of the Dominican crew members returning home from the cruise line industry on May 14th. They are all asymptomatic and will be quarantined for a period of 14 days at our government facility in Portsmouth. The technical team of the Ministry of Health has been meeting regularly to review and assess our COVID-19 status, as well as making recommendations to achieve the safest and smoothest transition while we reopen our local economy. On Monday, 18th May, we would have completed 3 two-week incubation cycles without a confirmed case. The technical team met recently, and an order will be issued in the earlier part of the next week, allowing more businesses to reopen. As mentioned previously, we must learn from the mistakes of other countries who have reopened earlier than the science recommended. This is precisely why we're going about reopening in a phased manner, based on international guidelines and in-country data available. We are fully aware of the tremendous strain and pressure that the public health and social measures are having on our traditional lifestyles. Cultural behavior we have known for our entire life is now being disrupted by COVID-19. For example, hugging, kissing, shaking hands, and other forms of socializing. For this, behavioral change communication strategies by our health promotion unit will continue and will also be intensified as we reopen. But we, the public, must play our part in putting this information given to us into action. Business establishments and offices must also play their part in implementing the measures and monitoring their establishments. While hand sanitizing, wearing of masks, and physical distancing may be adhered to, it is also important to have proper signage outlining the measures in a place at visible locations of the establishment. I must say, by and large, you, the public, have adhered to the public health and social measures thus far. We are again appealing to you, do not let down your guard. Do not become complacent. As we know, there may be asymptomatic cases, but these cases are capable of transmitting the virus. This is why we continue health promotion activities, quarantine measures, and testing of high-risk groups. These are the groups such as our contact tracing team, and we're going to continue with all the frontline workers, whether it's the accident and emergency department, whether it's the fire and ambulance. And then the Ministry of Health is also urging you, the public, to remain focused and continue adherence to all guidelines that have been recommended. I take the opportunity to express our deepest thanks and appreciation to all the frontline workers, local businesses who have contributed in one way or the other, also MMC Consultant Establishment Limited, that's for providing 4,000 viral transport media kits. For this, we're very grateful, which will increase our PCR testing capacity as well. Also, all international organizations, namely Pan American Health Organization and the Caribbean Public Health Agency, for providing technical support and supplies as well. The friendly governments, the Republic of Cuba, the Bolivarian Republic of Venezuela, and the People's Republic of China, who this week provided 2,000 of extraction kits and viral transport media, which will also help in our PCR capacity at our Princess Margaret Hospital lab. I wish everyone a safe and restful weekend, and I'd like to thank you, and may God bless us all. Let us not lose focus, let us be diligent, and let us continue all the measures that have brought us where we are today. I thank you.
Thank you so much, Honorable Dr. Irvin McIntyre, the Minister of Health, Wellness and New Health Investment. Again, it's just about 6 weeks since our last positive case here in Dominica, so let us all congratulate ourselves on the role that we have played thus far. Of course, we ask each person to continue doing their own individual assessment and determine what is worth the risk to you. What is worth your health, your safety, and that of your family and friends. We are beginning to feel a false sense of security because of our numbers, because we remain at 16 confirmed cases, because we're hearing that there's only one active case. We are becoming lax. This is not the time to become lax. This is the time to remain vigilant. So we're urging you, again, we're stressing that the protocols have been working. Let us continue to adhere to them. We thank you for your patience, and we thank you, all those who have complied so far. We thank you for doing that, and we ask you to continue to remain safe. Good evening.